I am here to be able to share a little bit of information about HEAL, the Health Equity Action for Lactation Initiative, a breastfeeding program for African American mothers and families. So as mentioned at the beginning of the summit, this effort is funded in part through a contract with the U.S. Department of Health and Human Services Office on Women's Health, and really is centered on improving breastfeeding initiation and duration rates in Black communities by prioritizing perinatal Black families, community health workers, organizations, and healthcare providers. We know that the American Academy of Pediatrics has the recommendations around exclusive breastfeeding and any breastfeeding, and we also recognize that there are barriers that sometimes keep families within our communities from being able to reach not only these goals, but their own personal goals. And so our strategy related to the Health Equity Action for Lactation initiative is really built on not only the information that Dr. Broomfield Massey shared, but also through some of our prior works with doing analysis of the landscape of breastfeeding. You know, everyone here in the room, I'm sure, is well aware of why human milk is important. We recognize what it means to two generations at the same time, the reductions of sudden infant death syndrome, lower respiratory tract disease, GI issues, diabetes, acute ear infections, asthma, are all reduced amongst infants that receive human milk. And of course, for the breastfeeding parent and mothers, we have a reduction in breast cancer, ovarian cancer, type 2 diabetes, coronary heart disease. And if you recall from some presentations earlier, we recognize how much heart disease is having an impact on the postpartum health of mothers, especially Black mothers. And so our why around this effort, we do celebrate that 75% of African American women have initiated breastfeeding. We're always going to celebrate that because that is a number that has grown over time. So we celebrate that. The CDC always gives a plus or minus about 3-4%. We also claim that plus on the 3.4% to increase that. We do recognize, and these are all data points from the CDC, that 25% of women do not breastfeed for longer than 6 months, and that 60% of mothers do not breastfeed for as long as they intend to. Some of the data already was shared earlier related to some of the breastfeeding rates among different ethnic groups, but this booklet here, the Saving Tomorrow Today, an African American Breastfeeding Blueprint, was something that was put together through a collaboration with Health Connect One and supported by the W. Kellogg Foundation. It was released in 2019. And this is one of those efforts where we pull together multiple people in a room, including families, researchers, support providers across the spectrum, to identify what was going on with breastfeeding across the United States. And we also utilized the PRAMS data to get some additional information to inform our report here. And so for this particular report, it was looking at infants born between 2009 and 2015, and some of the PRAMS data that comes out related to breastfeeding rates, and when you break the U.S. down by regions, show that we have the biggest inequities between, the Midwest and South regions. And it's not to say that inequities don't exist in the West or Northeast region, but looking at the disparity gap is a little more significant in the Midwest and South. The other thing that lifted from that work was that breastfeeding rates go down about 21% for non-Hispanic, African American, or Black families each week for the first 4 weeks after birth. And when we put together this booklet, it was an opportunity to take the information we gathered and put it out into the field as an opportunity for other organizations to see not only what the data was saying, but also to read recommendations that was coming from the community on ways that we can address this and to also maybe inform program development. And that's some of the things that is very key to our organization, is being adaptable to the needs of the community and what is surfacing. And so we wanted to ensure that even information like this, we made modifications to our own programming to ensure that we took some more effort around supporting families in those first couple of weeks in the postpartum period. The HEAL initiative comes as a funding opportunity that allows us to take the knowledge and information we have gained through this history of work and to further disseminate it more broadly. And so we established 4 pillars around this effort. And these 4 pillars includes practice, so expanding access to breastfeeding support for families; training, increasing trained breastfeeding support providers; collaboration, magnifying partnership among breastfeeding providers; and research, amplifying culturally relevant research. You know, as much as we do partner with a lot of institutions, Morehouse School of Medicine, University of North Carolina, to help facilitate research, we know we are not the end-all, be-all on none of this. And so it's so important to also lift up the phenomenal work that's being done in the field through culturally relevant lens. And that's important for us because all too often we would find research that has been done on communities of color, on Black communities, in a tone that is framing the issues on the individual behavior and not recognizing the systemic impact that is having an impact on how families are making their choices. And so we want to ensure that research that we amplify recognize those nuances, and it's important, and we want to be able to create the space in order for that to be disseminated, which is why we do summits just like this. And so Dr. Broomfield-Massey mentioned the health index and the public health regions. So HHS breaks down the United States into these 10 regions. And so, you know, if you look and you're looking at, you know, where we are here in Oklahoma, we are currently in Region 6, where my home is, an address in Georgia is Region 4, and so on and so forth. And so that maternal health index that Dr. Broomfield-Massey talked about and identifying kind of like the risk and so on and so forth is based on breaking down the states into the regions as HHS does. And what we found was that, you know, regions 3, 4, 6, and 7 had its highest need. And so this effort with the HEAL initiative is to impact all the United States. It's to do work in across the 10 public health regions. But we wanted to do this effort in a way that was strategic and ensure that we recognize geography matters and kind of broke it down a little bit. So we kind of situated each of the regions into cohorts. And so cohort 1 comprises of regions 4 and 6, which is our light green and turquoise area for the southeast, kind of southwest region. And so hence the reason why the Quad Regional Summit is where? Right here, because this is a part of our cohort 1 and activities that we've been doing and connecting with partners. And then cohort 2 comprises of region 3 and 7. And so if you look on the agenda, you'll notice that next to presenters' names, you see the regions that they're from. So this was very intentional on us prioritizing presenters from our priority regions that we're currently doing work on, are doing work in the near future, in order to not only, you know, ensure everyone is informed of the innovative work that's being done, but also, once again, relationships matter, and to continue to build on that relationship connection. So what is some of the efforts that we are doing with this effort? Our key thing is around building your village as a campaign messaging with this initiative. And so that prioritizes, once again, the perinatal families, communities, and providers across the spectrum of care. is a dissemination of resources. Raise your hand if you're familiar with the It's Only Natural breastfeeding campaign. Okay. So this right here is a part of why we're doing this effort, because this is a campaign from the Office of Women's Health that's been around since April of 2012. And a lot of people still aren't aware of the resources associated with it. Raise your hand if you're familiar with the Office of Women's Health Supporting Nursing Moms at Work resources. Okay. All right, okay, a couple more hands there, but we would like to be a point where all hands are lifted. And once again, it's a great resource that is industry-specific ideas and ways that families in different industry spaces can navigate their lactation journey. And then, of course, I would ask about your guide to breastfeeding, but we kind of gave each one of you a bag with one. So the data there might be a little skewed if I asked you about it. But they are in the process of updating these materials, but we're also wanting to ensure that people are aware that these resources exist, right? So we don't have to reinvent the wheel. And with this being resources, all the things that I mentioned, from the federal government, that means your tax dollars has paid for these resources, and you get to utilize all these resources for free 99. You can modify these resources, make it more geography specific, more community specific, more culturally relevant, and all you have to do is just give credit to the Office of Women's Health. They, have a quick little statement. But the thing is, people don't know they exist to utilize. Then it just kind of sits on the interwebs, and collects the cobwebs. And I don't think those are the kind of webs they want connected to the resources. So some of our activities that we are doing with this work is our community-based trainings. And because we have support with it, we're able to make collaborations in partnership with those of you in the room and be able to offer these trainings at a very good, steep discount, i.e., free 99. And then we have other resources, of course, with our Reaching Our Brothers Everywhere, the Queen Circle, conferences, and TA. And so this opportunity allows us to provide this expansion of support to you all that's a part of this community, and to ensure that we're also disseminating the resources that are there and providing some TA about how you can utilize these resources in a meaningful way. So we do encourage you to partner with us. We all have your contact information now once you've registered. So you will be continuing to hear from us. We have a stakeholder meeting kind of coming up next week on the 21st, and we'll push out information on how you can register for that. It's virtual, so you don't have to pack up and go anywhere. But it's so important for us that we are continuing to develop the partnerships, because this work can't be done on our own, and we just recognize the power of relationships. So that rounds up what Health Equity Action for Lactation is. We just wanted you all to know that the HEAL acronym had its meaning, and what the meaning was behind it, and what the initiative was behind it, and why you see us here today.